Submarginal versus marginal free gingival graft. This is the second procedure of the same patient, which is the previous case, code number 4475. The learning objective in this case at the second procedure is when you should select the right procedure according to the site, failure of free gingival grafts to cover root surfaces and even to provide adequate zone of attached gingiva, predictability of success and failure of a free gingival graft. In this slide here, which was the first procedure, by performing a free gingival graft, we were able to achieve adequate zone of attached gingiva and a decent gingival marginal height. Now, in the second procedure, the same patient was to correct the severe recession of the lower left canine and the bicuspid and create an attached gingiva to the canine and the bicuspid by a free gingival graft. An epithelial free gingival graft was dissected from the palate and sutured at the papillae of the lower left canine and bicuspid, which is considered the most coronal position of the graft to cover the root surfaces. This slide showed 10 days post-operative healing. The old epithelium of the graft has been sloughed away, leaving the underlying connective tissue nourished by the blood supply of the recipient site, which is the periosteum and partially the connective tissue. Note at this time, 10 days post-operative, the free gingival graft was intact up to the cervical margin of the canine and bicuspids. The palate in 10 days post-operative healing showed poor healing and still connective tissue exposed without epithelialization. In 3 weeks post-operative healing, you can see the tissue maturation of the graft, but without any root coverage. You can notice on the lower left slide the free gingival graft at the canine tooth has completely sloughed away, despite the fact that it was present 10 days before. You can also note the gingival graft has been epithelialized in 3 weeks post-operative at the bicuspid region. However, it lost partially the root coverage that was present 10 days before. The donor site in 3 weeks post-operative showed epithelial creeping in width and in length. In the upper two slides show the first free gingival graft procedure, which was meant to correct the submucosal grafts at the lower incisors, while the two lower slides showed the free gingival graft procedure to correct the submucosal grafts which failed to create an attached gingiva at the lower left canine. However, the free gingival grafts here created a good zone of attached gingiva at the bicuspid area, as you can see it here. So why the free gingival graft failed to create an attached gingiva and cover the root surface at the lower left canine? Now, with the lower left canine, we had wide deep defect according to Sullivan et Atkins back to 1968, and a class 2 Miller classification. As you can see, the mucosal margin passing the demarcation line or at the demarcation line of the mucogingival margin, and you have here the papillae at the height of the cemento-enamel junction. If you go to the surgical procedure, you will find the apical part. The apical part of the graft, which is right here at the canine tooth, has not been lying over the recipient side to have enough blood supply from the periosteum. The graft was not wide enough to cover the root surface coronally and apically to lie down over the vascular recipient side of the graft. Also, the prominence of the lower left canine, the prominence of the root of the lower left canine could be also a cause of having the graft failed to cover the root surface. So, in order to correct that, I probably would go for an incision at the mesial aspect of the canine, of the bicuspid, the first bicuspid, and rotate this as a pedicle graft to the distal of the lower left incisor in order to cover the root surface and create an apically attached gingiva at the site. This procedure will be considered as soon as the patient returns back, and by finishing this case, you have seen the success and the failure of 2 free gingival grafts at the lower anterior region in the same patient.